Today's event is the fourth and final installment of our 2021 discussion series, and we are incredibly grateful to have so many joining us, both today and throughout our medical profession through the lens of human flourishing series. Next slide, please. In collaboration with 7 founding member schools, the KNN is dedicated to advancing character and caring in medicine with the goal of promoting human flourishing. We believe that when clinical learning environments, care settings, and healthcare organizations support well-being and purpose for learners and professionals, that clinicians, patients, and families can truly thrive. Next slide, please. Advancing caring and character towards flourishing. It's a lofty aspiration and one that we believe can be achieved together. Character is a word that can have different connotations, so I would like to take just a moment to pause and define our terms in this context. To clarify what we mean by character, I'd ask you to consider the following questions. What strengths do you imagine those in healthcare demonstrating when they're at their best? Curiosity, humility, teamwork, compassion. The work of James Arthur and the Jubilee Center has described strengths like these as the building blocks of character across several major dimensions: intellectual, civic, performance, and moral virtues. As we look at these categories, I think many would agree that healthcare training and practice tend to emphasize intellectual and performance virtues, while civic virtues are not frequently explored in great depth. Next slide, please. That's one of the reasons that we're focusing on civic responsibility within healthcare, both what that can look like and what it requires. For some, civic engagement as individuals in our personal lives may be relatively comfortable or at least a familiar concept. But what does it mean to get involved in your capacity as a healthcare professional? To take risks, to step out of traditional bounds of caregiving, and in some cases, to stand up to authority or voice an unpopular opinion. Today, we aim to foster brave spaces and consider how to align personal and professional values to make a civic difference. Next slide, please. And to do just that, we are joined by several outstanding panelists who inhabit this space: Dr. Abdul El Sayed, Dr. Jasmine Zapata, and our moderator for this afternoon, Dr. Greg Margolis. Next slide, please. To set up our panel discussion for today, we're going to be starting with a brief video. But before we launch that, I've got just a couple of quick technical tips for you. For best viewing today, please select speaker view as shown here on the slide. To submit questions for our panelists, please send a chat directly to Q&A, and we'll be excited to gather your questions. So, with those technical issues out of the way, let's begin by looking at one situation that illustrates the broader challenges and rewards of civic engagement in healthcare. Austin, if you would please play the video. Thank you, Austin. Now that the stage is set, I'd like to welcome our moderator, Dr. Greg Margolis, to begin the panel discussion. Greg?
Thank you so much, Kamara, and thank you all for being here today. I can think of no better example than the video that we just watched, highlighting the work of Dr. Mona Hanna Atisha in the Flint water crisis. And this is a wonderful and inspirational story about the impact that clinicians can have when they get involved in social engagement and social responsibility and civic responsibility. And I am really excited to be joined by two people that are incredibly inspirational and are going to help us talk a little bit about this incredibly important topic. Before I start, by way of introduction, I'll just mention that I work at the National Academy of Medicine, and my primary job there is to oversee the Robert Wood Johnson Health Policy Fellows Program. And it is a program that is ostensibly set up and committed to the notion that clinicians have a role in the policy process and engagement and have a civic responsibility to help inform the decisions that are made at federal, state, local, and global levels. So it's wonderful to be able to share this experience with two new friends that I have made over the planning for this session. Dr. Abdul Al-Sayed, and I'll make a couple of brief comments about their amazing and impressive backgrounds, but then I'll turn it over to them shortly to tell you a little bit more about some of their current work. But Dr. Al-Sayed is a physician, epidemiologist, educator, author, speaker, and I think one of the most interesting aspects of his career is his commitment to communicating in ways that are accessible to all, where he serves as the host of America Dissected, an award-winning podcast that explores the intersection of science, politics, and public policy. There are a couple things in both Dr. El-Sayed and Dr. Zapata's background that they may not mention, so I'll just highlight them a little bit. One of the most interesting things I found out about Dr. El-Sayed is that in 2018 he ran for governor of Michigan and had a very, very impressive showing. So if there's anyone that has a commitment to this civic responsibility, it's him. And then we're also joined today by Dr. Jasmine Zapata. Jasmine is an author, physician, health educator, speaker, youth empowerment specialist, and community leader. She's a 4-time author and has been featured on numerous national television outlets, such as and including the Today Show. And I am so inspired by her mission to heal, uplift, and inspire. It's a pleasure to be with both of you today. I'm inspired by you and really excited about the opportunity to talk about this important topic. So why don't we go ahead and start, and we'll start with Dr. Zapata. And I thought maybe we would start with just a little bit of introduction. I've made a couple of observations about your impressive careers, but maybe if you could talk a little bit about when we say civic responsibility, what does that mean to you? And what are the types of things that you're doing now that highlight some of your commitment and interest in this particular area? Jasmine, do you want to start?
Yes, I can. And thank you so much for the honor and the opportunity to be here today. So when I think of civic responsibility, I believe that it is a conviction to get outside of the clinic walls to impact change. According to County Health Rankings model, only 20% of health outcomes are based on what happens in the hospital and clinics. The other 80% is based on one's social and social economic status, environment, and individual choices. And so I spent many years studying to be a doctor. Ever since I was 5 years old, I said, I want to be a doctor because I thought that was like the highest form of service. That was like the #1 way to help people. But then when I got to School of Medicine and Public Health and I saw those statistics, I was upset at first because I was like, I spent all this time to be a doctor and what we're doing inside the hospital walls is only impacting 20% of health outcomes. So when I saw my own life play out some of the very health disparities that I was studying in school, when I had friends and family members losing children, dying too early and too soon, I said that it is a conviction. I must get outside of the clinic walls so that I can impact change. Yes, I'm a physician and I was trained in medicine, but guess what? I'm getting ready to, as a physician, change systems, change structures, push the limits, and really do all that I can to make true change. And part of that is participating in civic responsibility. So I'll stop there, and I'll let Dr. El Said go.
Yeah, I loved the way that Dr. Jess put that around the recognition that people spend most of their lives outside of the clinics and hospitals in which we spend, unfortunately, so much of our lives. And that disconnect forces us to actually ask ourselves, is it enough to work in the system when actually so many of our patients and the people that we aim to serve spend so much time outside of the system? And so the argument that I would make is that not only do we need to work out of the system around thinking about all of the circumstances that rob people of access to a long, healthy life, that create the inequities that we have to be talking about and working on, but we also have a responsibility to work on the system, and recognizing that there are clear barriers that keep people out of that system, even when they need it. And I think the work of thinking about our civic responsibility is in asking the big picture questions around what our responsibilities are. And oftentimes, those responsibilities, they form around the institutions that we are a part of. And I've always believed that institutional leadership may mean accelerating the direction that an institution is going. But oftentimes, a lot of the institutions that we work in and on have a stated set of aims, and then they have a revealed set of aims based on what they actually choose to do. And when those stated aims and those revealed aims don't match, I do think that we have a responsibility to rethink the definition of acceleration, because of course, anybody who's taken a physics class knows that accelerating either means changing the velocity at which you move in a direction or changing direction. And I think sometimes that directional change matters. The other point that I'll make here is that we also have to challenge ourselves. People don't go into medicine because it is the iconoclastic thing to do, right? Oftentimes people go into medicine because we're really good at following protocol. And sometimes protocol is not working for the people that we say we want to serve. And that means stepping outside of our comfort zone and sometimes being willing to forego the validation of institutions that we seek to change so that they change for the people that we say we want to serve. And I think calling ourselves and holding ourselves accountable, not to what validation is intermediated by the institutions we work in and work on, but also holding ourselves accountable to making sure that we are in community with the people that we want to serve, and making sure that the institutions within which we serve are consistent with the values and are not gatekeeping against the very people that we aim to serve.
Well stated, and what a great start to a great conversation. Let's go back a little bit to the video that we used to frame today's conversation. And again, it's really just one example of many where clinicians have made an enormous difference in the communities that they serve, not necessarily just at the individual patient level. One of the references in the video was what the eyes don't see. And through the retrospectoscope, I think everybody's heard about the Flint water crisis, and it's easy to look backwards and say, oh my gosh, how obvious that is, how egregious, how visible that clearly is to everybody. But when you hear the story of Dr. Mona, you come to realize that retrospectively it may have been obvious, but prospectively it was not at all obvious. And much of the things that she brought up went against a lot of conventional wisdom. And when she said that the emperor had no clothes, she was dismissed as, quote, unfortunate, hysterical, wrong. So she certainly helped make visible something that that wasn't. And I wonder if we could reflect a little bit from your clinical backgrounds and some of your experiences, and maybe colleagues and friends that you've worked with. What are ways that clinicians can help communities and decision makers see things that we see all the time, but that may not be visible to them? Or, and we'll be charitable and say that that they want to see it, but they're just not seeing it.
I can start for that one. When I think about this, I'm reminded of something that made me a little nervous that I did last year. I know we'll might talk about it a little bit at the end about when you do radical things or things that might be a little risky, but this question here reminded me of that. So I will never forget the morning that George Floyd was murdered. The day that George Floyd was murdered and it was on the news, I was actually at the hospital getting ready to do a shift in the newborn nursery. And I remember sitting in the office and audibly weeping in the office. So much so that if people walked past, they probably were wondering what was going on in there. Audibly weeping and sobbing. And I needed to get myself together so that I could still see patients. But as a Black woman in America, as someone who has had my own cousin shot in the back by security guards and racism involved, it was very triggering for me. And even to just walk around and have to see other people, it was just the hardest day to get through. And I had a lot of feelings bundled up, and I just wondered, what can I do to just highlight how there's racism going on in our criminal justice system, but also, as bad as that is, there's racism going on right here in our hospital walls. How can we engage our public health and healthcare community in this issue? So this was right after that happened. And so I was able to partner up with a national organization, White Coats for Black Lives, and partner with some student organizations at our School of Medicine and Public Health to bring a White Coats for Black Lives chapter to our institution. But also we said we must do something to bring awareness to this more than just sending out an email or going outside of the hospital and taking a knee. We really need to do something to bring more awareness to this. So at that time, there were, if you can remember, there were so many rallies going on all across the nation. So I said, we're going to put our white coats on and we're going to have a rally at the Capitol. We're going to call everyone, all healthcare workers from across Wisconsin, and we're going to go to the Capitol and we're going to have a rally. So we were able to, within 2 weeks, and I was one of the main ones spearheading this. And at that time, it's something that, kind of like, should we be involved in rallies? Because a lot of them were associated with looting or some negativity. But I said, no, we're going to do this. So within a week and a half, we were able to gather over 1,000 healthcare workers at the Capitol. And what we did strategically was we invited members from the community most impacted from different community organizations, particularly Black men who led different organizations and other people from the community, to come and really just pour out their hearts to all of these healthcare professionals. And so there was parts of the rally that were everyone clapping and excited because there was things that made you feel good, but some of the things that were said were cutting, basically ripping the healthcare community apart, saying, you are no better than this police officer who just killed this Black man when there is so much racism right here in our own healthcare systems. What are we going to do about it? And you can tell because there were parts people were cheering and there were parts people were just absolutely silent. But ultimately, in the end, there was so many amazing things that came as a result of that. So back to the question of how can we bring awareness to things that are sometimes invisible? I have so many examples, but that's just one example. Sometimes you need to do things a little radical, a little different, that are not expected, have bravery to push the limits and bring people in who can tell the story rather than just writing about it or giving statistics. Partner with people who have lived experiences, and sometimes the truth is going to hurt, but that's what will shake people into reality and action. But I'll stop there. That's just one example.
Well, there is no growth without discomfort, and thank you for bringing some of those difficult conversations and discomfort to people that needed to hear and to feel uncomfortable in a time that of reckoning for this country, and the struggle continues, of course. Abdul, what are your thoughts on the issue of clinicians' role in helping communities, individuals see things that maybe that are not visible to them?
Yeah, I want to just go back to Dr. Mona's very touching tape. I was serving as the health director in the city of Detroit while the Flint water crisis was unfolding, and Mona is a personal hero and a good friend and a mentor. But what was I want to sort of walk folks into how she discovered what was happening, is that she was making observations. She was deeply listening to what she was seeing in front of her and asking about whether or not the experiences that her patients had generalized. And I think sometimes it's easy to sort of think about a patient in front of you as an isolated individual without paying attention and listening more deeply for the patterns that you see. And I think the experience of lead poisoning and the bump in lead poisoning, which she then looked at and asked whether or not there was an empirically provable increase in lead, and was able to discover that was happening to her patients, that came out of an intuition, because she had the willingness to connect and to think about the patterns that brought her patients together and their experiences together. And so I think by listening deeply and asking, what are the things that I keep hearing and I keep seeing in my patients? What are the broader structures that they are pointing to that exist outside of the walls of this clinic? And what does that mean about what I ought to do? And then the second is being willing to treat your patient as a whole person who lives in a wider world. And I think oftentimes we limit ourselves in medicine to being able to treat the pathology that happens underneath the skin, right? If it's something that I can identify that is going on in your body, then I can treat that. But when it comes to all of the ways that society marginalizes you, puts barriers up to your thriving, makes you sick, keeps you from the basic things that I recommend that you do, then somehow I'm helpless, right? And what's worse is that we guide people as if they have full autonomy over the circumstances of their lives, right? How often do we tell people, you really ought to eat better and you should exercise more, without asking about the circumstances in which they are acquiring their food and the circumstances in which they walk and engage every day. So you say that to somebody who either cannot afford or does not have access to healthy foods. What you are doing is you are blaming the victim of a broader system. And so I do think that we have a responsibility to be asking, how do we treat the broader circumstances in which we find our patients? And part of that is being willing to have conversations about politically touchy topics. And the hard part sometimes, I think, about our activism is that we will work on an issue, but we sometimes are unwilling to bite the hand that feeds us. And what I mean by that is that we work in a highly corporatized system that delivers a certain level of reward to the same groups of people because they have built a system to do exactly that. And I think sometimes we become uncomfortable when it comes to the business of medicine and the ways that necessarily keeps people away from access to, whether it's the resources that we offer or resources in the broader community. And I do think that sometimes we have a responsibility to speak truth to the power that has its hand over us. And that may come with some real costs. And so, whether it is asking about the practices of our hospital at which we work, or the practices of the health insurance that reimburses the care that we provide, I do think that is an important space for us. And also engaging our patients so that they understand the system. Why is it that if I have Medicaid, I can't see any doctor? Why is it that my Medicaid reimburses at 50% the value of private insurance? And then bigger picture, if you're Black in this country, you are twice as likely to be on Medicaid which reimburses at half the rate, right? And so just if you do the math, we are basically saying that the value of healthcare delivered to a Black body is systematically less valuable than the value of healthcare delivered to a white body. We say that every single time we allow a Medicaid reimbursement to go at a lower value, every single time we decide that a Black individual who has suffered the consequences of systematic racism at every level of their life and every circumstance of their life, that person on Medicaid ought not to actually have care that reimburses at the same rate, right? And so these are issues that we need to be leaders on, and it's leaders both in organizing with our patients, being willing to empower them to treat their malady. If you're willing to say, look, you should eat more healthy and you should exercise more, you should also be willing to say you need to stand up against the system that's keeping you from having insurance, right? And those are one and the same. And sometimes we are unwilling to give that advice because it feels like, well, that is outside the bounds of a clinical encounter. But if you're truly committed to the well-being of the person in front of you, well, then that should mean empowering them to take on the system that often marginalizes them. So we need to be great listeners and deep listeners for the patterns that exist, but also we need to be willing in our interactions with patients to have the conversations about the systems that often hold them away from the resources that they need and deserve in their lives.
What a great point. Jasmine, do you want to build on that, or?
Yes, this is excellent. This for me is personal and professional. So I think about when you talk about combating the very systems that are causing some of these inequities, I think about when we look at, and you talk about Black bodies, I think about the inequities in birth outcomes where Black women have 2 to 3 higher chance of having a baby born prematurely or dying before the first year of life. College educated Black women have 2 to 3 higher chance of that compared to white women who are high school dropouts. And I've read that statistic for years, doing community service and community organizing around this, going to the School of Medicine, UW, University of Wisconsin School of Medicine and Public Health, so I can work on this issue. And then to my surprise, during second year of medical school, suddenly going into preterm labor at just 25 weeks and 0 days pregnant, having a baby born who was just 1.5 pounds. While I was in medical school to help solve these very issues, I wasn't a high-risk pregnancy. I wasn't on drugs. I wasn't using alcohol. I was college educated and beyond. For that to then happen to me, it just shook me. And then going through, I said, okay, after my daughter survived, she needed multiple brain surgeries, heart surgery. She was septic, on life support. Many days they would call me and say, hey, you need to get to the NICU. We don't know if she's going to survive. So when she made it out of that NICU and got to come home, I promised, and I said, I promise I am going to dedicate my career to finding out how can we prevent this from happening. And I'm going to be a neonatologist. That's what I said. I said, I'm going to be the type of doctor who saved my baby girl. So that's how I ended up going into pediatrics. But when I was in the field of pediatrics, I saw how social determinants of health played such a big role in patients' experiences and even birth outcomes. And so I kind of shifted and said, instead of, and no shade to the neonatologists out there, I love you, but I made a huge career shift. Instead of going into neonatology as a fellowship, I was approached by some leaders in the field of preventive medicine and public health. And they convinced me to, instead of going into neonatology after my pediatrics residency was done, to go into preventive medicine and public health, so I could work on the very systems and structures and things that impacted birth outcomes for Black women, just as Dr. El Said was saying. And so that was so amazing for me and empowering, because in this situation, I was what he's saying is resonating so much, because I was that very patient. And so I decided to go into the field of preventive medicine and public health. And then shortly after that, I took a faculty position at the UW School of Medicine and Public Health to do community-based research on ways that we can improve birth outcomes, work clinically But then most recently, I got offered a position to serve as a chief medical officer for community health at the Wisconsin Department of Health Services, where now I am helping to make multi-million dollar decisions that impact birth outcomes. Just tomorrow, I'm going to be giving testimony at a hearing to extend postpartum coverage for Medicaid for beyond the 60 days to 1 year. So I'm going to be able to take my experiences, the experiences of my patients, and testify for something that can change millions of lives. And it is just so empowering to do that. So when Dr. El Said was mentioning that, it's just resonating a lot with me, because literally what he's saying shaped my entire career pathway. And I'm a physician, but I'm also a patient as well. And that's why this is so touching to me, because civic responsibility, it's important, but it's not a us and them. It's a we. When I go advocating for suicide prevention measures, for postpartum Medicaid expansion, when I am talking about economic justice and combating the housing crisis in our state, it's not me doing it for patients. It's me doing it for me. It's me doing it for my family members. I am some of the very disparities that I'm working to combat. And it's so empowering when you're able to participate in civic responsibility and engagement, so you can make those very changes. So I'm just very touched by all that's being said.
Well, let me tell you how touched I am by your willingness to share your story and how you have used those lived experiences to make the world a better place. I know that sounds maybe a little corny, but I mean it with great humility, and it's very, very wonderful that you're willing to share with everybody today. You know, I'm going to jump to one of the later questions that I was planning to get to, because I think there's a natural transition here, and that's really about courage, if you will. And, you know, because both of you have touched on this in some of our previous conversation. And, you know, of course, the Flint water crisis is a story on many different levels. You know, you could look at it as a story of crumbling infrastructure, political indifference, placing profit over health, environmental injustice, erosion of our public health system. And it is all of those things for sure. But, you know, to me, one of the most uplifting and maybe hopeful parts of the story is that of an individual clinician who had the bravery, the courage to be able to stand up to the establishment at what had a real potential to be not only professional, but even personally dangerous. So I guess what advice, because both of you have examples of demonstrating this type of courage and bravery, what advice would you have to a clinician who becomes aware of something that they think is morally unjust, but is trying to summon the courage to do something?
I can jump in. I really appreciated Dr. Jazz's story, because what you showed us is how you take pain and you turn it into power, right? And that capacity to make and find power in pain, I think is, you know, so much of the kernel of hope that drives movements and changes things for people. The thing I hope that folks think a bit about is privilege when they think about the courage that a clinician can, and I'd say must show. By the very nature of being a physician, right? You are among the most privileged people in the world, right? If you're a physician in the United States of America, you have ascended to a level of privilege that's that's incredibly important. I actually think that in some respect, privilege, it has power, and its power is to create privilege. And you either are using your privilege to create power for people who already have it, or you're using your privilege to create power for people who don't. And sometimes that ability to turn privilege into privilege for people who don't have it means that you have to put your privilege on the line. It means that you have to be willing to say, you know what, I am going to withstand what a powerful institution is going to say about me, what powerful people are going to say about me. They are going to potentially take my prestige or my opportunities or my job, but I'm here for the people that they say they want to serve. I'm not here for that institution. And I think getting that right is really critical, because the other side of it, right, the other conceit here is to say, well, if I stay quiet and I just go about my job, someday I'll be in a powerful position where I can actually do something about this. But the problem with that logic is it's self-defeating, right? Because there's really no end to it, right? It's always sometime tomorrow. And it's a great way to put off, to procrastinate actually having to put your privilege on the line. And so I think engaging in the practice of bearing witness to people's pain and asking, how do I empower them to turn that pain into power? And how can I be the conduit through my privilege to do that thing? I think that's the question, the coin of the realm. And what I've found, right, is that at some point when you stop caring about what powerful institutions have to say about you, at some point, that's when powerful institutions start to care what you have to say. And so I hope that folks can take some solace in recognizing that if you are bringing value to people, oftentimes value to the people who are least heard, that there's some karma, there's some goodwill that I think comes out of that, and you have to have the courage to take that first step. The last thing I'll say is this: for me, my experience growing up, my family immigrated to this country from Egypt, and I spent a lot of my summers, like many children of immigrants, back in the old country. And there I'd spend my time with the most intelligent, really most gifted person I'd ever met, who never had the opportunity to translate her gifts into all the things that society offers in a place like the one that I grew up. That was my grandmother, my teta Soad, and she never got to go to school. She was illiterate, but best storyteller I've ever heard, and had this ability to just lead from a place of just a calm sense of goodwill that she engendered with almost everybody. She lost 2 of her infants before the age of 1. My dad was her oldest. He watched 2 of his siblings die. So there's an aunt and an uncle that I had who are buried somewhere as infants. And the crazy thing for me is that I was always the cousin who would come back to Egypt and hang out with all my other cousins, my grandmother, my grandfather, my uncles, aunts. And my grandmother, in her very, her way of doing things, would always point to one of my cousins and say, that one's smarter than you. Point to another one and say, that one's taller. You already know that. Point to a third one, that one's better looking. That one's nicer. That one's kinder. That one's, and at some point I was like, what do I have going on for me? She said, well, you have opportunities, and that's the most important thing. And she couldn't even understand what opportunities I had. She just knew that because of the circumstances of what I was growing up in, that I had so many different opportunities. And so it was always a reminder that my opportunities are fundamentally an accident of history. My dad gets to move to the United States. I get to grow up here. I get to drink clean water and breathe clean air and go to a good school and get access to healthcare, all because my dad gets to move here. And I think about my cousins, many of whom, none of whom have the opportunities that I have, some of whom drive cabs in Egypt, and that's not my life. And so the question is, well, what's the point of that accident of history? And how selfish would it be if you just used that for you? Well, I got this, they didn't. So how do I figure out how to make the most out of it for me? And so I think there's a responsibility to step back and say, all right, so what do we do with that? The only difference between my experience and everybody else's experience is that I got to see the other side of the accident of history. Frankly, all of us are accidents of history. The fact that all of us have the opportunities we have, there are so many other we's we could have been born as who don't have that. And I think we owe that so much more. And I think we owe that to say, well, I'm going to spend my time here in the privilege that I have by circumstance of what I was given, to make sure that other people have that too. And so I do think that, we have that responsibility. We have the the push to say, I'm going to use what I have to make life different for someone else, rather than just to make life different for me.
Jasmine, again, you've faced many of these challenges that require brave action. What was it? What advice would you have for others that are trying to muster the courage?
Yes. My advice would be to begin with the end in mind. And I'll say that again, begin with the end in mind. I will never forget being in college, and I minored in psychology, and I took a class called The Psychology of Death and Dying. And it was an amazing class. And the goal of the class was to make you confront your own mortality so that you can leave from the class with a renewed sense of purpose and meaning for your life. There are studies that show that individuals who experience near-death experiences, they come from those with a new sense of purpose and meaning in life. And so the class was meant to mimic a near-death experience and make us confront our own mortality. And so we did a variety of different activities, but one I'll never forget is that we had to actually write our own obituary. And that was a little scary because I'm like, okay, you know what? I'm not about to write this into existence. I don't even want to think about this. I'm going to live forever. You know, I was young in my higher teens, younger 20s, but I actually did it. And coming out of that experience really opened my eyes to the fact that we don't have forever to be here. And when people are looking back on our lives, what are they going to say? What difference are they going to say that we made? And even if it's not, even if other people's opinions, it doesn't really matter what other people are going to say. If you were to write your own obituary, what meaning do you want this life to have? And when you put it in that perspective, some of the things that used to be a little bit, may have been scary, when you think about it from that, it's really not. It's scary to live a life of safety where you're ignoring injustices or things you know aren't right just to kind of stay under the radar. It's more scary to me to live a life like that rather than being courageous and standing up for what is right. And I was especially reminded of that just 2 weeks ago. My cousin passed away from multiple myeloma, and she was in home hospice, and I had the opportunity to take care of her in her last few days of life. And even in her last moments, I will never forget her just taking her last breaths and me being there at the exact moment life was over, and being a part of the planning process for the celebration of life. And it really just had me thinking, you know, her life was so short. She died in her 50s. And, you know, I'm looking at my age and saying, if I knew that I only had, 15 more years here on this earth, what would I do differently? My own brother passed away suddenly at just 16 years old when I was in college, 3 months before I was getting ready to take the medical college admissions test. So life is not promised. We don't even know if we're going to be here for 80 to 100 years. So you have to live a life that you can look back on and be very proud of and have no regrets. So for the advice that I have for those of us who might be a little bit scared to do things that are out the box or bold or things that are a little bit different, would be to begin with the end in mind. When you're looking back on your life and you're looking at this decision and what role you played in that issue, are you going to be pleased with that? And will you have any regrets?
Wow, I just have to say, both of you are demonstrated such bravery in your responses and willingness to share things that are so ingrained in your persona. And both of you have amazing lived experience of taking challenges and turning them into, and seeing the opportunities that are within there. Begin with the end in mind. Great advice. Recognize your privilege. Use it for positive effect. Great advice. I'd like at this point to turn things over to Kamara. She has a short exercise that everybody's going to participate in. to think a little bit about what some of your words have meant and how we might be able to convert them to action. Tamara?
Thank you, Greg. And thank you, Dr. Jazz and Abdul, for your insights, your wisdom, your example, your authenticity, and the challenge that you've put in front of all of us today. And as Greg mentioned, we would like to hear from you. And so in just a moment, we'll be opening the audience questions, an opportunity. If you haven't already placed a question into the Q&A, please do so. And as we transition to that, we'd like to take a moment, as Greg mentioned, to have you consider how you might apply what we've learned today from these amazing panelists. So through Poll Everywhere, we're launching an open-ended question. What is one thing that you plan to do to advance progress regarding civic responsibility in healthcare? In the chat window, Jean has just shared a link to Poll Everywhere. And so you can respond to the prompt there, and we will share your anonymous responses at the end of the session. If clicking on that link is just more than you want to do today, you can participate by text message as well, which is also in the chat. You can simply send the phrase KNN discussion to 37607, and then that will join you into that Poll Everywhere, and you can begin texting in your responses at that point. So we're going to leave this question and the opportunity for you to respond open during the Q&A time. And again, we'll return at the end to see what everyone's thinking about in terms of the challenge that's been put before us today. So Greg, let me turn things back over to you.
Great, thank you. Well, I know that we're going to lose Dr. Zapata right at 5 o'clock. So I do want to make sure that we get to a couple of questions that have been submitted by audience members. And John said he appreciates the speaker's passion on civic responsibility. You know, I wonder how educators kindle learners' passion for civic responsibility. And in particular, his question is, how might institutions and educational programs nurture the emerging passions and instill that as part of the professional identity of people that have the privilege of taking care of people as their vocation and avocation? Jasmine, would you be willing to kick that off?
I can start. I would say that it is very important to connect this topic with the individual experiences that impact learners' lives. If you just give a general course or general information on civic responsibility, it might not connect as much. But if you lead and start with, what is one of the biggest issues that has impacted your life? Or what is one of the biggest things in society you wish could change? What are some of the biggest struggles that you see play out in your friends and family? So start with the problem and then have them connect it with different ways and outlets that they may be able to advocate. Because when you connect things to people personally, then it's more than just a job or it's more than just a course. They see that, man, this can really change the quality of life for myself, my community, and those that I love. So that's one example. There is a mini course that I created and implemented with pediatric residents who rotate through the newborn nursery. And I share my story of prematurity, talk about a lot of different statistics related to birth outcome inequities. And then I have a series of questions, discussion questions that we just engage in. And one of them is, as a pediatrician, what do you believe your role is in solving this problem of racial inequities and infant mortality? And then I just pause. And the conversations that come out of that are so amazing. Instead of telling someone, having them actually struggle with that and see, is it my role? Is it enough to just gain my medical knowledge, know how to diagnose and treat? Or do we as physicians have a higher calling, that privilege that Dr. El Said mentioned, using our stories? And it's so awesome to just see over the course of the 4 weeks that they're with us, how their ideas change. So those are some of my insights on how you can incorporate this into curriculums and also get them very excited about it.
Let me build on that and ask Abdul to respond. One of the things that we find when we talk to physicians about social determinants of health and is they get that housing and transportation and nutrition and are all the clean air, clean water are all parts of the things that lead to health, perhaps, or more than the medical care that they provide. But the frequent answer is they understand that the social determinants are important, but they don't even know where to start. And they know what to do about the results of those, the cumulative results of those and many other social ills. Abdul, what might be a way for someone to just start? What's a couple of first steps that are manageable, that can help people start down this path of civic responsibility and on this journey?
Yeah. So I want to speak just first to the culture sometimes of medicine and medical education, and then answer your question directly. I think we have to be a lot more self-critical about the kind of culture that we inculcate. And to begin with, medicine is not a very risk-averse path, right? No, when you tell people you want to be a doctor when you're a kid, nobody's ever like, why would you do something like that with your life, right? It is not a space where people who want to move off the beaten path will go, right? And that is one thing about the sort of selection bias of our craft. The other is that we inculcate an extremely hierarchical culture, and it is not one where you are encouraged to question the inherited wisdom of people who have been doing this longer than you. And even the efforts to do so are not taken very well from higher ups. And I think one of the most important things you can do is encourage a space where your trainees and your students can actively question you and actively ask why and to push back. I think that is absolutely critical. The second is that I think we have to understand that the institutions in which we work are going to continue to create the same outcomes unless we choose to change them. And the onus is on us. I firmly believe that doctors are the most powerful voice in medicine, but we have allowed our voice to be co-opted by people who will maintain the status quo at all ends because, well, it delivers a lot of money to a couple of people and a couple of people at the top of those institutions. And unless we're willing to actually ask the big picture question about whether or not we think that's right and just, I worry a lot about, sort of letting off the steam of our frustration with the system while we then just go back to work in the system, right? And I think unless we're willing to actually take our frustrations and actually turn them onto the systems in which we work and change them actively, which means rethinking where the money flows, right? Fundamentally, then I don't think in the end we will have done what our responsibility is to do. To your point, Greg, in the questions that you asked, I think one of the most important things that I tell clinicians all the time, and I don't practice day to day, is if the only place that you meet people like your patients is in the hospital or the clinic, you don't know your patients. And so the question that I would ask is, how do you go and make community with the people you take care of in the places where they make community, right? And we tend to assume that because you share 15 minutes with someone and the power structure inside that room means that they only usually tell you the things that they know you want to hear, that means that you know those people. You don't. And so I would say, go find those folks in the places they spend time, whether, it is the union hall or it's the local church or you name it. Go spend time, take off your white coat. Don't show up as Dr. whatever, show up as just who you are, your first name, and get to know those people as people first. You'll understand their clinical circumstances in so much more profound way. And also you'll appreciate what it is, right? What the structures in their lives are that create the circumstances that they struggle with. For me, that happened in a bit more of an organic way, but still not an organic way when I ran for office. Obviously, you go and engage people where they are, but you're still coming with a lot of the biases of you're an aspirant to political office. But it also, forced me to sort of be in a space with someone where I was asking them for something rather than the other way around. And I think it's really important that we get really thoughtful about the ways that hierarchies and our white coats and our institute clinics and our hospitals may shape the interactions that we have. So I would start there.
What a great way to close. Let me say, I'm inspired by both of you. I can't believe how fast the time has gone. I have 3 take homes personally. From what you have said, I've gleaned leadership matters and that healthcare providers have things to offer in civic responsibility. I'll paraphrase, but the biblical reference to those who are given great privilege, they have great responsibility. And to begin with the end in mind, what great take-home messages. I'd like to turn things over, and I know we're a little bit running short of time, to Jean to share with us a little bit about what we heard from the poll everywhere. And it seems to me that many of the things that you both have said have resonated deeply with the people, with those who are able to spend our time together. I am inspired by both of you. It's a difficult time for our country. There's no question about it, but conversations like this are what are going to get us through these challenges. And I can't tell you how enriched I feel by the opportunity to have gotten to know both of you even a little bit. So thank you for your work. Thank you for your passion. Thank you for sharing your life stories with us in such a effective way. And with that, I'll turn things over to Kamara with deep appreciation for the opportunity to be here today.
Thank you so much. Dr. Sapato will all say thank you again as you run to your next very important meeting. Thank you for the time and taking the time to be with us today. Well, on behalf of the KNN board and the team, I would like to extend, as Greg said, the most sincerest thank you to all of you for being with us today, for the incredible responses and commitments that you've made to, proximity, listening deeply, leading with your own authenticity and brave vulnerability. We're grateful to the exceptional panelists and partners who walked us through these ideas today, and particularly grateful for the generosity of the Kern Family Foundation, who really have made the work of the KNN possible. Next slide, please. Thank you also to our partners at UW-Madison for managing continuing education credits. In just a moment, there will be a slide that will come up that's going to talk a little bit about disclosures, accreditation information, and instructions for claiming credit. Those same instructions and the information can also be found in the online portal where you registered. Most importantly, if you need to record your attendance by text, please note that you have 24 hours after this session to text CAMNAW to 608-260-7097. Next slide, please. Well, if you were inspired by today and you are looking for more, as we look ahead to 2022 at the KNN, we're going to be diving even deeper into healthcare and flourishing in our upcoming series entitled Human Flourishing 2030. Imagine, if you will, for a moment that it's 2030 and we live in a healthier world where healthcare learners, practitioners, and patients are flourishing. What does that future look like? And what will it take to get there? Well, we're going to need your voice and your participation to chart that future. An increasingly interconnected world requires us to widen the lens and consider the big picture of what influences health and thriving, much like we've been discussing this afternoon. So next year's discussion series will explore the impact, the challenges, and the opportunities that different aspects of our ecosystem pose for the future of human flourishing in healthcare. Our first session in January will focus on flourishing in our communities, building on some of the themes that were raised today. So please watch for more registration details. And until we're together again, we hope that our panelists' experiences and wisdom and bravery and your fellow attendees' ideas for action will help inspire you to take your next step in advancing civic responsibility. Thank you again. Have a great evening.